Now we'll see what is the difference between seizure and epilepsy and what is meant by epileptogenesis. What is meant by seizure or convulsion? Seizure or convulsion are the same things. Now what is meant by seizure? Seizure is a clinical manifestation of an epilepsy. In simple words, we can say seizure or convulsion is a clinical manifestation of an epilepsy. But here, by definition, it is an excitation of the cortical neurons. As you can see, there is a excitation of cortical neurons. Now, when we say excitation of cortical neurons, this excitation is normal. But when it becomes abnormal and excessive, whenever there is a abnormal and excessive excitation and there is a synchronization of a cortical neurons, then we'll say it's a seizure or convulsion. What is seizure? It's a clinical manifestation of epilepsy. It's a clinical manifestation of epilepsy. Okay. And in what happens normally, there is a excitation of cortical neurons. Excitation of a cortical neurons. But in case of seizure, there is a abnormal and excessive excitation of cortical neurons. Okay, there is abnormal and excessive excitation of a cortical neurons. Then we call it as a seizure. Now, epilepsy. Epilepsy means recurrent seizures. We can simply say recurrent seizures. We call it as a epilepsy, or a tendency towards recurrent seizure which is unprovoked by any systemic insult or acute neurological insult. What is epilepsy? Epilepsy is a tendency towards recurrent seizures. Tendency towards recurrent seizure which is unprovoked by any systemic or acute neurological insult. Now, epileptogenesis. Epileptogenesis means sequence of events that converts normal neuronal network into hyperexcitable network. What is epileptogenesis? Epileptogenesis, sequence of events that converts normal neuronal network into the hyperexcitable network, and that is called as epileptogenesis.